Welcome to the Global International Pedagogical Forum, IPF 2020, which I'm representing now. My name is Lilith, and today my guest is Ahmed El-Kafrawi, Emeritus Professor of Microbiology and Immunology at the Medical Department of the Al-Azhar University of Egypt. Honorable Professor, we do appreciate that you took your time to participate to our forum and answer our questions.
Thank you very much for contacting me. I really appreciate your efforts and the efforts you do for letting people know about the COVID-19 or the SARS-2 virus, which is causing a pandemic nowadays.
Thank you. So more than 200 countries all over the world faced the coronavirus infection. So there is a huge amount of information about it, including true and false facts about it. So the very first question is, does COVID-19 really exist?
The answer is yes. Because the test we do, which is a PCR, is a test to detect the genetic material of the infectious agent and could be classified based on the information we have as a member of the coronavirus. So it cannot be a false information in spite of all of these data.
So COVID-19 is just an ordinary flu, or is something more serious? Because many scientists talk about the scientific nature of it, that it was developed in the laboratories. What do you think about that?
I think that it's more serious. I think that COVID-19 is more serious than just ordinary flu. The reason why I say so, because the human beings do not have any immunological background about this virus. This means that everyone practically is susceptible to infection. How much will affect people as clinical data, I cannot tell right now, but some people should have a better immune system than others. So not knowing much about the data concerning people, whether they are capable of protecting themselves or not, I think it's more serious than any flu.
So is COVID-19 only a virus, or is there still a political and economical side of it?
Well, I should say that COVID-19 is a virus and it causes infection, and some people actually develop serious manifestations, and even some of them do die as a result of this infection. As any outbreak or epidemic or pandemic, whatever it might be, it is reflected on economy. Economy guides the political life of all countries. So it should have a background in politics and in economy, but it is not a political and economical matter. It's actually a clinical problem.
Okay. So how many people actually get sick, and what is the scale of pandemic now?
Well, as far as I know, I mean, till June 2020, the number of cases worldwide is about 7 million cases. And actually, there's a death toll about 450,000 human beings. So this makes it quite a serious epidemic, or pandemic, I should say.
So how to deal with this pandemic? What to do with the virus infections?
Well, to start with, I should say that our information is still limited. Is that it is transmitted by the respiratory tract, meaning it's when we inhale these droplets, the droplets settle in our respiratory system, virus attaches to the cells of the respiratory system, and infection starts. Also, contact droplets can fall on surfaces. That's why if we should put our hand on a surface, it can carry the infectious material. And once we scratch our eyes or nose or put our hand in the mouth, there is a chance that the virus can get into our body. So the thing we know as far, which is useful for protection, is that we should wash our hands regularly, especially if we go outdoors and come back. Whenever we receive any parcel coming from outside the house, inside the house, and so on. Another thing is that we should put a mask on our faces. This mask is not 100% sure to protect me, but it lessens the chances of transmission. Actually, the mask is more important for people who are infected rather than the people who are not. Because whenever I talk, whenever I cough, whenever I sneeze, droplets come out. And the presence of the mask will prevent the droplets from getting outside to the air in heavy doses. Dose is very important in transmission. It's not only the droplet, how much particles of the virus I will inhale. So the presence of this is, on the faces of people who are infected is most likely more effective than for people who are not.
You mentioned that this is a novel virus, so a few months later we can say that we know a few facts about the coronavirus. We know that incubation period is about 2 weeks. We know the risk groups, men and women over the age of 60. We know that asymptomatic carriers can infect others. What else do we know about, what else can be added to this list?
Well, what we should know is that most of the people who get exposed to the virus do not develop symptoms, or at most, symptoms are like flu, common flu. So people will not notice it most of the time. But I should say, those people who did not notice that they are infected, they are capable of transmitting the virus to other people. Because they are not suffering does not mean that they are not hazardous to other people. That's one point. Second point I'd like to add is that the virus incubation period, yes, it's known. People at higher risk are known, but we also know that there are deaths among young people. What we that the people who are having chronic lung disease or heart disease or old age are the most susceptible to infection and would succumb to it and probably die. But the clinical experience, young people died also, especially among medical staff.
Yes.
As I said before, the data we have is not complete. We have a lot of data, yes, but it's not complete so far.
And what about the treatment? So far, no effective treatment has been developed. So we already know that it is unusual flu. It's a new novel virus, but there is no new fundamental treatment. When it will appear?
That's right, Lily. What you say is correct completely. We do not have a specific treatment for the COVID-19 or the SARS-2 virus. All we have are experimental trials here and there, and some of them give some degree of success. As far as we know, there is not a new, really effective treatment which is developed so far. It might take us a lot of time to reach the definitive treatment. This happened with hepatitis C, for example. It took us several years before we could develop an effective treatment. And once we had this treatment, we started to control this disease. I think this will be the same situation related to COVID-19. What we have now so far is symptomatic treatment. Fever, we take some paracetamol to lower the temperature. There's secondary infection, we take antibiotic, and so on. But we do not have something which is targeting the virus itself so far.
And what about the vaccine? Because there are different opinions about that. Some says that it will appear soon in a year or two. Some says no, it will appear in 5 years. So when it will be really appear?
Well, that's a good question. I should just say that there are a lot of problems that we might face to have a new vaccine. One of which is its safety, meaning that it should not harm the people who receive it. And this only done after prolonged clinical trials, so that we make sure people really benefit rather than get harmed from a vaccine. The second thing, the vaccine should be effective, meaning that it should cover the virus, whether it has subtypes or doesn't have. This is not not clear so far. There are 3 major mutations that are reported about the virus, and so the vaccine should be able to protect against all of the 3 mutants that we know so far. Perhaps in the future we'll have more mutants. I'm not sure of that. Third thing is it should be produced in suitable amounts so that we can protect the whole global population in a short time. All of these problems, in addition to the cost of the development and production of this vaccine, are limiting factors that might delay having an effective vaccine in the nearby future.
You mentioned that the virus affects people differently depending on their immune system. So what about the immunity? Does it develop after the virus, or people who got sick again, who got sick will never got sick again, and how long this immunity will protect us? What do you think about that?
Speaking of immunity against the virus, any infectious agent in our body should produce immune competent cells that are T cells and some antibodies of different classes, IgM and IgG mainly. The point here is that the body should develop what's called neutralizing antibody. That is the antibody that attaches to the attachment site, the attachment piece of the virus to the receptor on our cells. I heard recently about immunological trials to use convalescent plasma as a protective measure or as a treatment for COVID-19. I don't know how much neutralizing antibody is there in this randomly obtained serum or plasma samples. We should have information so that we know how many units of the neutralizing antibody is there in the preparation, so that we can unify the dosage. And second thing, whether or not the people develop really protective neutralizing antibodies. This data not very clear in literature. They claim there is neutralizing antibody, but they don't say how much percent of the antibodies produced by the infected people is directed to protect against the virus. This will limit our use of plasma, except as an empirical system.
There were a lot of conversation also about that with summer temperatures, the pandemic will decrease. So is this true, or if not, can we expect that in autumn, in the season of when the flu is rises, we can expect the second wave of the pandemic, of the infection?
Really, it's a difficult question to answer. Sometimes I read about some countries, like in Italy, the outbreak is calming down, meaning the number of cases is going down, death toll is getting less. That's true. But I should say that people are isolated so far. Most of them are not going outdoors, and social contact is limited. And this means that a lot of people are not exposed at all to the virus. Don't know when the things turn to become better and people go outdoors, what would happen? A carrier among the people can spread the disease and will start a second wave of the disease. And I don't know whether it will be the same or less severe or more severe. Nobody can predict. But I should say that as far as we know, that the number of cases is not big compared to the global 7 billion people. Only 7 millions are infected. This means that it's 1 in 1,000. This means that 99.9% are naive to infection with this virus. And as I said before, we have no previous exposure to this virus as well, so that we don't have any previous immunological experience with it.
Okay, so you mentioned that the self-isolation as a measure against the virus. Also, many states imposes quarantine in their countries. Is this an effective measure not to suffer from the virus, or it should be done differently, like to develop herd immunity, as it was said? What do you think about that?
I think that the final outcome will be a herd immunity. This is true, but we should continue using the protective measures we use today. We can use the masks, we can use face shields as well. We can continue to have gloves on our hands, but we should also understand that they be changed every several hours, as the manufacturer suggests, that gloves should be replaced every now and then so that I don't get myself infected. I think people have to go back to work, but they have to go on this condition. They are well protected by the general terms that I said, just masks, face shields, and the gloves in the hand. I think they can start to go back to work, provided that they know how to use the mask properly, not covering the nose and the mouth, should be changed every time, so every now and then, so that it is effective in protection. And I think that infection will continue to exist until a good percentage of the universal population should be infected and recovered, so that it slows down. That's what I believe in.
Excuse me, I'm sorry, there is a technical issue. As I was informed, the recording was not on, so I will check one more time.
Okay, can you hear me now?
I hear you, but with the recording, you hear me as
The
well,
bandwidth
right?
is,
And you see me.
yes. Okay. So do you want me to repeat the answer again?
Just one more time, I will check. Yeah, there is technical issue. I'm very sorry for that. We have to switch off the link and after should enter again in a minute.
Do you want me to do that or you will do it? Should I stay
No,
online? I disconnect.
no, you also should get out of the link. Just close the window, and after in a
Okay.
minute, just do it again.
Okay, I'll do it
I'm
again.
sorry for that. I apologize.
Never mind it. Okay.
So you mentioned that social distancing is an efficient measure to not to suffer from the virus. So some states imposed also the quarantine. Is this a necessary and effective measure so far, or the states should do it differently, for example, to develop herd immunity? What can you say about that?
Okay. Well, this is a very good question. Social distancing protected a good number of people from getting infected. Actually, the number of cases, which is about 7 millions, represent only 1 in 1,000 of the global population. That means that 99.9% are still naive to the virus infection. Once people get back to work or stop social distancing, there is a good chance that the virus will spread again. I don't know how it will happen this time. Will it be as severe as the first wave, more severe or less severe? Nobody can predict. But all I can say is that people, if they have to go back to work or go outdoors again, they need to maintain the protective measures they are using now, meaning they should put on gloves in their hands, they should have masks on the face properly covering the nose and mouth. Better if they have face shields also, and then they can start to go back to work or move around again. Hopefully that the infection rate will not be high this time, because a higher infection rate is reflected on the capacity of hospitals to deal with these cases. And that's the main reason why they advise for social distancing and these protective measures. I think in the absence of a vaccine, which is useful so far, in the absence of effective viral chemotherapy, the situation is still not clear in the next fall.
Okay. What do you think? Why is COVID-19 so dangerous if it is not dangerous?
What about it?
Why it is dangerous? COVID-19, why it's dangerous?
Okay. COVID-19 is a newly emerging virus. This means the whole population of the world, the 7 billion people of the world, have no previous contact with this, had never been exposed to a similar virus. This makes all the population susceptible to this virus in the future or in the time being as well. With this background in our mind, people can easily become infected. So it means that everyone will have a disease. Most of the people who have a competent immune system will have a mild symptom or maybe no symptoms at all. But I'm talking about those who will become clinically ill, will be always there. We don't have any built-in measures in our body that protects us against this virus so far.
Most of European countries has passed the peak, and the lockdowns are being relaxed and the restrictions are removed. And what is the situation in your country now?
Well, till the time being, we are having some limitations on moving around. Gathering places are not open all the time, and they do not allow to get inside a place in large numbers, thus in a suitable number that can be controlled. They did not remove the restrictions so far. However, the number of cases is growing. I mean, every day we have more cases and more cases in spite of all these restrictions. The number in Egypt have exceeded the 700,000 cases, which is a big number as a matter of fact.
Okay. Dear Professor, thank you so much for your interesting interview and your valuable opinion. Stay healthy and safe.
Thank you.
Thank
I'd
you.
like to thank you, thank the organizing committee, and I wish you good luck in your efforts.
Thank you so much.
Have a nice day.